was the signing of Pact Silica, and this is indeed seen to be an important move between the two nations where they agree to strengthen the cooperation in emerging areas like technology and especially artificial intelligence. But yes, artificial intelligence is at the core, one of the key themes that have been discussed in the markets as well. So let me take it across to the management of Fractal Analytics to know what is the company doing in that particular space and what are the key triggers. Is one of those recently listed counters. And for that, let me welcome Mr. Srikanth Velamakanni, who is the co-founder and Group Chief Executive and Executive Vice Chairman of Fractal Analytics. Hi, a very good morning, Srikanth, and thank you so much for your time. So good having you on the channel today. And firstly, let me start with your Vaidya 2.0. We believe that that has scored 50.1 on Health Benchmark, seen to be outperforming the OpenAI's GPT's 5 and Google Gemini's Gemini Pro 3 on the challenging benchmark. So why don't you start by highlighting what parameters is where they're outperforming these two?
Let me explain what Vaidya 2.0 is. Vaidya is a set of models that help you get medical advice. So this is more as much for patients as much as it is for doctors. And there's a range of things we tested on. For example, can it detect an emergency situation, alert the authorities, or make a phone call for you so that it directs you to medical authorities or emergency help? It can it really ask you questions so that it can clarify your medical situation? Can it understand a clinical journey and see if you have a chronic disease? Can it help you through the processing of that chronic journey? And for a doctor, can it offer like a co-pilot? So this is the idea of Vaidya 2.0. The models are new, Vaidya 2.0. Vaidya.ai is available to everybody. It's a web app. You can log into Vaidya.ai and upload your reports and get help. It's also available on WhatsApp, where most of India operates. So maybe you can just sort of upload your reports, have a conversation, and it remembers your information and then alerts you to the right things, etc. Now, the reason this benchmark is important, this benchmark is called HealthBench Hard. It was set up by OpenAI last year, and the idea is that very difficult questions on health. It looks at the model performance across emergency referrals, about context seeking, about whether it can hedge and give you information while collecting more information from you, various kinds of parameters. And all of these parameters, Vaidya 2.0 models are performing better than the best in the world today. So it is the best model in the world today on health. And that's why we are super excited, because it shows that Indian AI can build world-class, world-leading models.
Indeed, thank you so much for that detailed explanation, Srikanth, on what Vaidya 2.0 is. But if you can help us understand that what is the total addressable market opportunity that you are looking for this particular product?
Right. So if you look at healthcare, $1 in 6 spent in the world is spent on healthcare. So healthcare is a very large fraction of the total spends in the world. And AI is fundamentally augmenting healthcare in a very substantial way. So it is a very big market. Just to take that view, it's much larger than anything else, right? It's probably 2 to 3% of world revenue. That's the kind of market that is there for in terms of healthcare, AI, total addressable market. We're also thinking of whether we could deploy this at an India scale. We are part of the India AI mission, and we met the Prime Minister last month. We showed him the vision of what this can do. If India can deploy this at the national scale, connecting things like eSanjeevani or health IDs or Arogya Setu, we have different health stack elements. We need an intelligence layer on top of that. If we did that, and if we made it accessible to the 1.4 billion population of our country, we can build something that is incredibly valuable, as well as will advance the state of AI in our country. So we think the market is large. It has a global market. It certainly helps our healthcare business, but it has a huge India potential as well, which we're very excited about.
All right, but Srikanth, you're also a part of that 10,300 crore plus India AI mission. What opportunities does this bring for Fractal, and how does it give you an edge against the competition?
So Fractal's vantage point, we have been partnering with the government of India in the India AI mission. And the vision that we set aside for India was to build a large reasoning model. And we have narrowed that down to saying large reasoning model for healthcare, because we think healthcare is one of the most important verticals for India. And if we do well on healthcare, actually the country does better. So we said, what if we build a reasoning model, a large reasoning model for healthcare? Now, what are reasoning models? The idea is to move away from LLMs, which are large language models, to models that can reason and plan with data and take actions. So this model not only can process your healthcare information, it can diagnose illnesses and can even make a phone call to make sure that you're protected. So all of these things are possible. And what we want to do with India AI mission is to help India advance the state of AI and build frontier models, best models in the world through this method. So our vision is to deploy it at India scale, get feedback from all of India, and therefore advance the state of the art in terms of AI healthcare.
All right, interesting to know that. But Srikanth, with this, we let you go. So good having you on the channel today. Thank you so much for your time.
Thank you very much.
All right, so that was the management of Fractal talking to us about how they are ready to take the opportunity of this whole AI boom that we are still witnessing. But with this, viewers, time now to dip into a very short break. Don't go anywhere. We'll be right back on the other side.